I would like to welcome everybody here on the Zoom call today to the 5,540th meeting of the Rotary Club of Chicago. Rotary 1 is now in session. And for the thought of the day, I'd like to turn it over to one of our newer members, president and founder of Open One Solutions, a telecommunications and software company specializing in voice over IP, Mr. Robert Haney. Robert, the floor is yours.
Thank you, Eric. And for today's thought, on March 26, 1953, American medical researcher Dr. Jonas Salk announces on a national radio show that he has successfully tested a vaccine against poliomyelitis, the virus that causes the crippling disease of polio. In 1952, an epidemic year for polio, there were 58,000 new cases reported in the United States and more than 3,000 died. Today, I'd like to share quickly eight thoughts that you may not have known about Dr. Salk and polio. Although polio was the most feared disease of the 20th century, it was hardly the deadliest. Franklin D. Roosevelt proved instrumental in the vaccine's development. Salk challenged prevailing scientific orthodoxy in his vaccine development. Elvis Presley makes an appearance in support of the March of Dimes in the 1950s. Salk tested the vaccine on himself and his family. The clinical trial was the biggest public health experiment in American history. Salk did not patent his vaccine.
Wow.
Although a tainted batch of the Salk vaccine killed 11 people, Americans continued vaccinating their children. And a rival vaccine supplanted Salk in the 1960s. Thank you for my thought, for the Rotarian thought of the day.
Thank you very much, Robert. That's very fascinating. And I think that really sets the stage well for today's meeting. Ladies and gentlemen, you're in for a treat today. In recognition of World Polio Day, you are about to hear from the leading experts, advocates, and implementers for eradicating this disease from the earth. With the momentum created by the declaration of Africa as polio-free, District 6450, our district, wanted to step up the pressure on this disease to see if we couldn't have a record-setting fundraiser this year to get this thing done. 2 countries, folks, that's what we're down to. And of course, we need to be even more vigilant to make sure we don't slip backwards during the COVID pandemic. So the Rotary Club of Chicago is partnering with District 6450 on a fundraiser entitled Pioneers for Polio throughout the month of October. We've already raised $17,000. Once we hit 20,000, another $10,000 match will kick in. And what that all means is that basically your donations get multiplied by 6 when you include the 2-to-1 match by the Bill and Melinda Gates Foundation. You'll see the link in the chat box throughout the program to donate for this, and please donate generously. As we move forward into the program, note that there is a separate Q&A feature for this particular webinar mode. So do put your questions for our presenters later in the program in the Q&A box. So the brainchild and organizer for today's event is Marga Hugo, president-elect for the Rotary Club of Chicago. And if you're a Rotarian anywhere on the planet, you probably already know her anyway. Marga, the floor is yours.
Oh. Hello, everybody. Ok, buenas tardes. Antes de continuar, deseo mencionar que tenemos el agrado de ofrecer traducción simultánea al español. Si desean seguir esta conversación en español, por favor diríjanse a las instrucciones que verán en la pantalla. I just said for those who speak Spanish, they can see the slide with instructions to access the simultaneous translation in Spanish. So now I would like to give a warm welcome to all of you who are participating in this webinar from Rotary Club Chicago and District 6450, the home district, as well as from clubs from outside the district and around the world. We have very many of you. Among our distinguished attendees to this webinar, we have past President Ravi Ravindran and his wife Vanity from Sri Lanka, Mike McGovern, who is the chair of the Rotary International Polio Plus Committee, Zuzi Howe, RI Director for Zones 25B and 29, and Julio Santisteban from Peru, RI Director nominee for Zone 23B, and also Pat Merriweather Post, who will be a director, I believe, in the years 22-24. I'd like to thank our outstanding panelists and moderator for agreeing to participate in this event. Thank you, District Governor Chuck Corrigan, for being with us today. And our governor would later make more detailed introductions about our panelists. Each panelist will have 5 to 7 minutes to present, and I would kindly ask if each speaker today could stay within the limits, the allotted time period, so as to ensure we have enough times for questions and answers. We have with us Dr. Tunji Funsho, who not only is chair of the Rotary International Polio Plus Committee in Nigeria, but has also recently been named by Time Magazine one of the 2020 100 most influential people in the world. Our next speaker is Aziz Memon, trustee of the Rotary Foundation and chair of the Rotary International Polio Plus Committee in Pakistan. Judith Diment, who among other distinguished positions is a member of Rotary International's Polio Plus Committee and Rotary representative to the Commonwealth. And Hussey, who has put a face on the subject of polio eradication, winning hearts and minds for the cause and raising hundreds of thousands of dollars in the process. A polio survivor herself, the story Ann Lee tells is personal, and so is her journey in the fight to eradicate polio. And of course, our moderator, Jeffrey Kluger, editor-at-large at Time Magazine, and a huge supporter of Rotary in the Global Polio Eradication Initiative. Jeffrey Clark has participated in numerous Rotary events for which we are very grateful also to have you with us today. Jeffrey is also an author of several books, among them Splendid Solution, Jonas Salk, and the Conquest of Polio, and also Lost Moon, the perilous voyage of Apollo 13 that was the basis for the film Apollo 13 with Tom Hanks. Now, in terms of our format, Jeffrey will provide brief opening remarks, and then we will hear from each of our panelists. We will then go to the Q&A session. To the extent, well, you already said that, Eric, so I won't repeat. Your questions go to the chat box for questions. Okay, with that, let me turn it over to you, Jeffrey, from some opening remarks. Thank you very much for being here, and the floor is yours.
Thank you so much for having me. I do appreciate it. I want to start today with something most people don't know about Jonas Salk. The man did not doodle. That is not, that's a pretty obscure thing to know about a historic figure, but I think I can say it with some authority. In the course of writing my 2005 book, Splendid Solution, about Salk and the polio vaccine, I spent many, many hours in the library at the University of Southern California, San Diego, where the Salk archives is kept. And I had the occasion to go through tens of thousands of pages of Salk's letters, memoranda, lab reports, and memos. In all of them, I saw what appeared to be just a single doodle, a little triangular scribbling on a single page in a lab notebook. That was the entire body of Jonas Salk's artistic work. But Salk, of course, left a far larger legacy behind in the form of millions upon millions of lives saved and cases of paralysis averted. And that work required a monomaniacal focus, one that could not abide even the distraction of a doodle. It's the same kind of focus Rotary International has brought to its mission to rid the world of polio forever, a mission it assigned to itself in 1998 and has pursued tirelessly since. Thanks to Rotary and its partners, we've seen the disease, which was endemic in 125 countries just 32 years ago, run to ground in only 2 remaining lands, Afghanistan and Pakistan, and it will soon be pushed over the cliff to eradication there too. I like to think of myself as an early beneficiary of Salk's and later Albert Sabin's work. I was born in the spring of the Great Polio Field Trial of 1954 and was among the first babies to receive the Salk vaccine in 1955. My life might have been saved by Salk's and Sabin's work. It is a certainty that the lives of hundreds of millions of other children have been. And it's an equal certainty that Rotary has played a huge and historic role in that great act of decency, love, and public health heroism. I'm proud to be able to help celebrate that today. Thank you for having me here.
All right, I'm Chuck Corrigan, and I'm the District Governor of District 6450, and it's my pleasure to introduce our first panelist who's going to speak, Dr. Tunji Funsho. Now, it takes perseverance to wipe out a deadly and crippling disease in an entire country, and more so for an entire continent. In the face of civil unrest, resistance to vaccination, and limited access to remote communities, Dr. Funsho and his team persevered to eliminate the wild polio virus in Nigeria and all of Africa. As Margaret mentioned, Time magazine recognized him for his instrumental leadership in the work of Rotarians and our partners to eradicate polio in Africa. Dr. Funsho has been a Rotarian for 35 years. He's a member of the Rotary Club of Lucky and a past district governor of District 9110. He is a cardiologist and a fellow of the Royal College of Physicians. As a member of Nigeria's Presidential Task Force on Polio, he coordinated immunizations and advocacy campaigns with the Minister of Health and state agencies. We are delighted to welcome you with us today, Tunji. Thank you.
Right. Thank you very much for having me with you today. It's a great honor and privilege, to, at least in virtual form, cross out one of my the wishes, as we all say, that I want to see fulfilled, before I hit, 6 feet down. This is on my bucket list, and I would make sure that I do that in person. Now, polio eradication, inching towards the finishing line, starts and ends with the image you see on your screen. All the efforts we've been making in the last 35 years, from fundraising till now, has singularly been geared towards getting these precious drops of the oral polio vaccine to children to prevent them from being paralyzed. All the challenges we have faced are challenges that have been trying to prevent us from doing this. And all the challenges we're going to face in the future are challenges that we have to surmount to ensure that these precious drops get to the mouths of our children. Next slide. We therefore are grateful for our ability to finally rid Nigeria of the wild polio virus, and by so doing, rid the whole world, the whole continent of Africa, of the wild polio virus. WHO certified Africa a polio-free region on the 25th of August this year, which we all jubilated and celebrated about. We did that because, next slide, we've come a long way from where we started. From polio cases of 350,000 every year around the world in 125 countries, to now just 2 countries being ravaged by the wild polio virus. We've reduced the numbers of polio cases so far this year to less than 230. And 130 rather. We have done that with the singular mind of ensuring that every child gets this precious drop. But we lagged behind quite a bit in Africa. Until 1976, again through the prompting of Rotary and its leaders, which eventually, next slide, culminated in a meeting of RI President then, Louis Giaye, and the trustee chair, Raja Sabu, holding a press conference in Africa in 1996. a continent which until that time had never had any mass immunization campaigns. And that singular effort and initiative led to Africa, which was contributing 70,000 polio cases every year and about 50% of all global cases, for 30 countries in Africa mounting immunization campaigns within a year. And through that, we have gradually reduced the cases of polio in Africa to 0. There has been no case of wild polio virus in Africa since the 24th of August, 2016. And that's a great tribute to Rotary's persistence and tenacity and leadership as far as the global polio eradication program is concerned. Next slide just shows Nigeria, the numbers until we got to 0 in 2014 and had a resurgence in 2016 because of the difficulties with the insurgents in the northeastern part of Nigeria, which with a very robust outbreak response, heavily supported by Rotary, and also the involvement of our leadership at the highest level, because that outbreak response in 2016 had in attendance our IPPC chair, Mark McGovern, and Polio Plus director, Carol Pandak. Despite the risks, they joined us to motivate Rotarians and get the governments and partners to realize that we are the leaders in this effort. The next slide shows our polio status worldwide at this current time. The last report, which is the report of the end of last week, shows again, like I mentioned, 2 countries, 74 cases so far in Pakistan and 51 cases in Afghanistan. This is despite, and we must look at this against the backdrop of all the challenges that Pakistan has faced in the last 1 year. And I'm sure my very good friend, Trustee Aziz, will go into details of that shortly. Now, how have we, worked? What has been our areas of activity? Next slide. We worked essentially in 4 thematic areas: advocacy, creating awareness, and community mobilization, fundraising, and field activities. When I was invited to become the chair of Polio Plus in Nigeria, I asked IPPC chair at the time, Bob, that precisely what am I supposed to do? What are my terms of reference? And he just told me simply, eradicate polio. And I found that very interesting and very funny. So off we went to the drawing board with the members of my committee, and we drew out, these thematic areas. And we've been working in these thematic areas ever since. I need to talk a little bit about, next slide, the aspect of creating awareness, because we are in that season now. This is the week of the World Polio Day. And I'm sure all of you, in one way or the other, are gearing yourself towards celebrating this World Polio Day by continuing our advocacy effort, creating awareness, and as you're doing in your district, making fundraising one of your very important and cardinal projects. I hope more and more of us, despite the COVID pandemic and lockdowns, will find time to participate in this. Next slide shows the challenges we faced, and I'll just go through them very briefly because of time constraints. We have managed to overcome vaccine resistance, through using leadership at the grassroots level, particularly our traditional leadership and religious leadership. We still have, to a large extent, low routine immunization coverage, not up to the standard we want. And then, of course, the virus wants to survive, so we have the emergence of vaccine-derived polio virus. Insurgency, we have overcome, by and large. Inaccessibility, particularly because of terrain, still remains a problem. And of course, we continue to face funding gaps in our efforts. And as if those were not enough, COVID-19 came along and put spanner in the works. There's not enough time to talk much about that in this presentation. But people will always ask us, next slide, where does the money go? This is the Global Polio Eradication Initiative budget by activity. And you can see that though we have eradicated polio from Africa, we still need to maintain campaigns to make sure that those children who are missed for routine immunization get the oral polio vaccine. Surveillance will continue to be a major, major pillar of our efforts to eradicate polio. So number one, we pick it up before it spreads. And number two, we can look anyone in the eye and tell them with all moral courage that there's no wild polio virus anywhere. So that is one sure good reason to continue to contribute to our efforts. So as we work, next slide, to keep polio at zero in Africa and other parts of the world that are now polio free, we should also keep our minds on our final, most treasured goal of ending polio in the world by making sure that the last two countries remaining also have no more wild polio virus paralyzing our children. In the meantime, let us all, keep safe and keep away from COVID-19 by observing, those pictorial things I've presented. Rotarians together, we can do this. We've done it before. We have done it in 5 now African regions. And I'm sure with the efforts that we have used in eradicating type 2 and type 3 wild polio virus, we will succeed in eradicating the wild polio virus from the whole planet. Thank you all very much for giving me this opportunity to address you.
Thank you very much, Tunji. I wish we had twice the time to listen to you and all the other speakers. I would like to introduce now Aziz Memon. Aziz is a trustee of the Rotary Foundation. He joined Rotary in 1995 and has been widely recognized for his leadership in polio eradication. He has worked closely with Rotary's partners and stakeholders, including UNICEF, the World Health Organization, government officials, religious scholars, and leaders like the Taliban, celebrities, businesses, etc. And among multiple prestigious awards, he was one of our 4 polio eradication activists to receive the Louis Pasteur Medal by the Institut Pasteur. In recognition of his community and humanitarian services in the health sector, the President of Pakistan conferred the Pride of Performance Award on Aziz in 2011. Aziz, the floor is yours. We look forward to hearing what you have to tell us.
Thank you, Varga. Thank you. And my greetings to your club president, to your district governor, all my friends who are going to be speakers, and all my friends who are today listening to us. As we have heard that we have come a long way from 125 endemic countries, from 250,000 to 300,000 cases a day, to just 2 countries, and that is Pakistan and Afghanistan. We know that we have to finish the game soon, because now, after Nigeria being out of the endemic list of wild polio cases, all eyes are now looking at Pakistan and Afghanistan. Afghanistan has got different challenges. Inaccessibility is the biggest challenge. The Taliban's and the talks going on with Taliban's and USA are not coming to an end. We hope that the talks come to an end, because the virus, it is the same epidemiological block of Pakistan and Afghanistan. So the virus travels from one side to other. Pakistan is trying to complete a fencing for last several years, Every time they say 80% done, but it is still not done. So, it's very difficult to track the children crossing the borders. They cross in thousands. They cross 24 hours from Torkham border, from Chaman border. But other than those borders where Rotary has put PTPs, they cross from wherever they feel like. So it is a big challenge, and cross-border migration is definitely one issue. In Pakistan also, we have our own challenges of migration from one province to another. Rotary has put up 43 permanent transit posts to check and vaccinate the migrating children. These posts, according to an independent review, last year they gave the drops to 3.8 million children crossing from one part to other. We have our resource centers working in most of the super high-risk districts. We do regular health camps. We have put up almost 25 solar water filtration plants to provide clean drinking water to the super high-risk areas. Our Rotary Ulma Committee keeps on doing religious gatherings with all the mosque preachers and all the religious leaders to soften down the refusals and to make advocacy more feasible. My friends, on 22nd of April 2019, there was a campaign by the opposition party, a religious party from a small village in Peshawar, and in 2 hours, they, with the help of the media and the Facebook, they managed to stop the NID. That was for the first time. They've got 300,000 children in the hospital of Peshawar on the plea that 50 children died because of OPV. No one died. It took us time to gather from there. It took us almost 5 to 6 months to bring back our campaigns into the right mode. When we were all prepared in 2020 to go forward and start the work of stopping the virus, COVID came our way. For 6.5 months, the campaigns were suspended. Almost 80 million children in 35 countries were at risk, just not of polio, but of measles and other diseases. In July this year, after the recommendation of the technical advisory group, we resumed the campaign on a very small scale, protecting our frontline workers, and this was primarily for the derived cases. Now, derived cases have appeared in northern part of Pakistan and some parts of Afghanistan, and we had to stop them. So July campaign was focused on the derived cases. August was a larger round. And in September, after a break of 7.5 months, we were able to do the first national immunization drive targeting 40 million children across Pakistan. In this campaign, I would like to share with you gladly that it was for the first time that we were able to do door-to-door campaign in South Waziristan. This was possible with the help of Pakistan Army, because accessibility there is a big issue. As I just mentioned, we lost one vaccinator in North Waziristan, and these tribal areas are a challenge for us, are difficult for us. On the 18th of February, this very year, President Holger, Trustee Chair K.R. Ravindran, IPPC Chair Mike McGovern, flew into Islamabad and I accompanied them. They had a very long meeting with the Prime Minister, Imran Khan. They had a lengthy meeting with the Chief of Army Staff, General Bajwa, with the Health Minister. They visited NEOC, and they were quite satisfied with the commitment given by all of them that they will make sure that polio is no more. Unfortunately, COVID came, but then now, when we started the NIDs, General Bajwa was the first one to start giving the polio drops, and he made a statement which was carried on all the media that we will stop polio virus circulation in Pakistan in the year 2021. And after that, one general who has been given the charge of polio, he was last week in NEOC. He spent the full day there reviewing the September campaign and discussing how the October campaign is going to take place. In October, November, and December, we plan to have full-fledged NIDs. And in November, December, for the first time, we are going to use trivalent. Now, trivalent had been discarded, but it had been made specially for Pakistan and Afghanistan because it is going to do dual function. It will halt wild polio, and at the same time, it will stop the derived cases also. For the derived cases, the novel vaccine is expected to be rolled out soon. They said September, when we are going to be, and we in Africa also has got a lot of derived cases. We are going to be the first recipients. So we hope that with the help of novel vaccine, we are able to halt the derived cases. And we are fully committed, my friends, to stop the transmission. And the Rotarians are going to go out on the streets in a big way on 24th of October. I can see a list of events. I had not seen so much of enthusiasm before. We hope that that enthusiasm is turned into action and we are able to stop transmission. And when my turn comes for giving answers to the question, I would be too glad to answer any question you have. Thank you for listening to me. And thank you for giving me a chance to speak. Thank you.
Thank you, Aziz. And it's my pleasure now to introduce Anlee Hussey as our next panelist. Anlee was only 17 months old when she was stricken with polio. The Salk vaccine was approved only a few months earlier, but distribution was limited at that time, including in Maine, where she lived. Anlee survived polio, and in her adult life, she has made the eradication of polio and the alleviation of the suffering by polio survivors her life's work. Anlee is determined that no child will needlessly have to suffer what she has been through. Anlee has led 26 National Immunization Day teams, taking these teams all over the world, including places not often seen by Westerners: Chad, Mali, Bangladesh, Madagascar, and Pakistan, among the others. Anlee's work has rightfully earned her the International Service Award for a Polio-Free World, the Rotary Service Above Self Award, and a White House Champion of Change Award for her humanitarianism. She has carried the message of polio eradication around the world, and we welcome her to our panel today. Thank you.
Thank you, Chuck. It's a pleasure to be with all of you today. And everyone else is adding the technical aspects to polio eradication. I would like to add a personal touch to better understand what we're dealing with. But first and foremost, we are living in an uncertain time with COVID-19, and I do wish for all of you and your families to remain safe. The current coronavirus outbreak for me is reminiscent of polio outbreaks that occurred across North America years ago. And how soon some of us forget, perhaps because so many of us were too young to recall. But the current outbreak made me think about the polio epidemics of the 30s, 40s, and 50s. People lived in fear of the polio virus as it spread through towns and cities across our nation. Children and adults were at risk, yes, even right where you are all living now. People avoided public parks, playgrounds, swimming pools, and theaters were closed. There were no large gatherings held anywhere. Those parents who could afford to would bundle their children up and leave the cities in hopes that more rural areas would offer them protection from the virus. Unfortunately, that didn't always work, and it actually helped to spread the polio virus to the more rural regions. No one knew when polio would strike, who it would attack, or really how to stop it. And in reality, they didn't really know how to treat the crippling effects of polio. They learned as they went. Some families were spared, others lost family members. Many had multiple family members affected, both children and parents. I don't recall this personally, but I know my parents felt the fear. And in the end, polio attacked one of their children, and that was me. During the outbreak of 1955, Boston was the center of one of the worst epidemics ever on the East Coast. The hospitals were overflowing. The sidewalks and streets were full of vehicles bringing in polio victims. Doctors were even seen on the sidewalks at night with flashlights. Triage took place on the sidewalks as best they could, and many people died. Social distancing, physical distancing was a real thing, and homes were quarantined. Sometimes whole streets were quarantined. It was a challenging time. Fortunately, a vaccine that came out that same year started to halt the polio outbreaks across our country. Today, we are in frightening times as the coronavirus spreads in ways reminiscent of poliomyelitis. But it's instructive for all of us to remember what it has taken to nearly eradicate polio, and a reminder of what we can do when we're faced with a common enemy. Here are some of my comparisons between the two diseases. Both COVID-19 and polio are caused by a virus, an invisible enemy. Both are spread through silent carriers, people infected but showing no symptoms. We weren't sure how to treat when COVID showed up. We've learned a lot since March. COVID-19 appears to attack mostly the respiratory system, but we now know that the blood system is involved and other neurological issues as well. COVID enters the lungs through airborne particles. Polio can also be transmitted via droplets from a sneeze and saliva, but primarily it is through the gastrointestinal tract in food and water that's been contaminated by feces. We think of polio primarily attacking children, but in our early epidemics, adults were also affected. And today we know that polio attacks primarily children 2 years old and younger. COVID-19 seems to have an affinity for older adults, but as time goes on, we see that all ages are affected. Isolation in hospitals was very common during polio outbreaks. Some polios spent years away from their families, similar to the isolation that we see today. Both diseases created fear, fear of the unknown. With COVID, we still don't know all that we don't know. And it's not just one person. Polio had an effect on the entire family, even if all did not contract it. With COVID, it is a bit similar. There's anxiety and fear felt by all family members, plus in some cases, extreme loss. COVID-19 appears to be more deadly than polio, although there were many with bulbar polio who died. But most polios have their limbs affected, primarily lower limbs, although upper extremities and the spine can also be affected. Time will tell the toll that COVID takes on survivors. I fear there will be repercussions, damage to one's lungs or other places in the body. Just as polio has after effects known as post-polio syndrome, it is expected that it will take time to learn what effects COVID will have on one's body, even after a mild infection. Healthcare workers will no doubt struggle with this disease after the worst of the crisis has passed. And there are some who compare the ventilators of today to the iron lungs of times gone by. But we need to realize the two diseases are different and that COVID attacks the lungs. They fill with mucus, whereas polio attacked the nervous system, which ultimately paralyzed muscles. So although at first glance you may think lungs were affected, that is not a direct effect. With polio, the diaphragm was paralyzed, the diaphragm being a muscle. And the iron lung worked in place of the lungs, forcing the air, in place of the diaphragm, forcing air into and out of the lungs. And in addition to causing paralysis, the poliovirus also disrupted brainstem control centers, for swallowing, breathing, heart rate, and blood pressure. And it has been shown today with COVID that too much pressure exerted on the lungs via a ventilator is not good. And here's an interesting piece of trivia. The first ventilator was created as a result of a polio epidemic in Denmark in 1952. Both viruses spread rapidly in dense populations. People in heavily populated cities and slums are more at risk than those in remote areas. However, if the virus reaches a remote area, it will spread quickly. Both diseases test healthcare workers to limits unseen previously, bringing out the best in all, creating heroes. And just as there was no vaccine during the epidemics across North America, there is no vaccine available yet for COVID today. There's an organization that first envisioned a polio-free world. Rotary remains at the center of the fight to eradicate polio, and we should never forget this. We have made incredible progress, and we're optimistic that we will succeed in this effort. And yes, there are challenges yet for us to face. But the Global Polio Eradication Initiative will remain the standard against all future multilateral public-private partnerships. It is the largest peacetime movement in history, and only the second time ever that human dedication and ingenuity has brought the scourge of a disease to the brink of extinction. In a world, especially today, that's fraught with dissension and folly, our success shines and proves that we can all work together across borders for the benefit of all. You know, eradicating a disease is really hard work, and anyone on this panel will tell you that. And getting to 0 cases requires sufficient funding, innovative strategies, perseverance, and the commitment of every single Rotary member. As a person with polio, I remain committed to our cause, and I'm asking each of you to stay committed with me. Every step I take is my reminder why we must eradicate polio. Every child you know, every child you see should be your reminder. Thank you for listening.
Anli, thank you so much for your very impactful words. You really make it personal, you bring it to life, and you help us commit to this effort. I would like to go on now and introduce Judith Diment, another hero of advocacy and fundraising like Anli. Judith ran an independent award-winning Thames Valley Public Relations consultancy and has held senior positions in marketing and communications for 30 years. Judith is coordinator of Rotary International Global Polio Eradication Advocacy Task Force since 2013 and UK National Advocacy Advisor for Polio since 2010. In 2013, Judith was appointed Rotary International representative to the Commonwealth. And in 2015, she was appointed to the International Polio Plus Committee. In July 20, she was appointed as Dean of the Rotary Representative Network to the UN and other agencies. Judith is also a prolific fundraiser involved in events such as completing a charity bicycle ride from London to Paris for the Royal British Legion to organizing an End Polio Now dinner in Windsor Castle. Judith, the floor is yours. We're delighted to have you with us.
Thank you, Margaret, and good afternoon, everyone. Thank you for inviting me to be here today. It really is a privilege, and thank you, Anli, for that very moving presentation, which explains why we're all here and why we're all dedicated to this cause. So I'm going to look at the effect of COVID-19 on the polio eradication program, and in particular on the financial aspects and what it means going forward for the next 12 months. So we entered 2020 knowing that we had challenges to address and overcome to stop transmission of polio in the endemic countries and to sustain and build on progress in other areas. The COVID-19 pandemic has been an unanticipated challenge, a curveball that nobody could have anticipated. And this map is a recent map that shows the countries affected by COVID-19. But actually, it's very reminiscent of the maps from the early days of our fight against polio, a virus that has impacted life throughout the world and which, like polio, was not well understood and initially lacked a preventative vaccine or effective cure, and therefore placing an extraordinary public health threat to communities and burden on health systems. And we've heard from Aziz how the polio program was suspended and has been restarted in September in Pakistan. Could I have the next slide, please? The next slide shows the impact of COVID-19 on polio eradication activities. So overall, since late February and early March 2020, more than 60 polio vaccination campaigns of different geographical scales have been paused in 38 countries. 6 million doses of vaccine have been delivered to those countries. They couldn't be used. Another 100 million doses have been procured, but still await shipment because of air freight disruption. Some of these vaccines have been delivered in the weeks running up to vaccination campaigns that were resumed in July 2020. However, other batches of vaccines will be nearing the end of their shelf life, and the polio program will have to bear the costs of the waste and resupply. Also, some of the suppliers are reaching storage capacity and may be well forced to stop production. There may be longer-term implications for manufacturers. The COVID-19 context for the polio program in Pakistan, Afghanistan, and Nigeria will be considered next. Polio surveillance has been continuing, but there's been a widespread and substantial impact on it, including a decrease in case detections in the Western Pacific, Southeast Asia, and Eastern Mediterranean regions. There's been a reduction of environmental surveillance in several countries of Southeast Asia and Eastern Mediterranean regions, and a significant disruption in the transport of polio-related laboratory specimens in the Africa region. Next slide, please. And of course, all of this has severe financial implications for the polio eradication program. The cost of conducting activities is now higher due to the addition of personal protective equipment. The programmatic pause means that the GPI is facing a larger budget than originally anticipated in 2021. And even with existing donor pledges and commitments, including Rotary's, the initiative is facing a gap in 2021 of up to $470 million US. In addition to our own fundraising efforts, Rotary and partners are continuing to work with governments and multilateral institutions to meet these urgent funding needs so that we can continue our progress towards eradication. Next slide, please. In its recent report, the Independent Monitoring Board highlighted the contribution made by the GPEI towards the pandemic response, saying the handling of the COVID-19 pandemic in many polio-affected countries and subnational jurisdictions has brought a great deal of praise for the polio program. It should be rightly commended for how quickly it was able to pivot staff to respond to COVID-19. It shows how investments in polio can be used in a much broader way for global health security. Next slide, please. So how are polio workers fighting COVID-19? Well, the Polio Plus infrastructure that makes up the backbone of the polio program are fighting COVID-19 in the way shown on these slides. Frontline health workers and teaching communities, they're teaching communities how to keep safe from COVID. Surveillance medical officers are investigating cases of polio and COVID and providing training for frontline healthcare workers. And just as they do for polio, when a person tests positive for COVID, their close contacts are also tested to determine if the virus is spreading. And this is a demonstrable example of the plus in Polio Plus. Over 86% of the polio program personnel in the COVID-19 response in parts of Afghanistan, they were mobilized, lending expertise to logistics, communications and surveillance, and COVID-19 coordination groups. Around 36,000 polio surveillance volunteers are carrying out disease surveillance and case identification in all provinces. And all 114 WHO provincial polio officers have been trained to report suspected COVID-19 cases alongside suspected cases of polio during their active surveillance visits. More than 100,000 community-based surveillance volunteers have been mobilized to disseminate messages about COVID-19 prevention and hygiene to local communities. And more than 3,750 members of the UNICEF Polio Immunization Communication Network have been trained and deployed to communities in the southern, eastern, and western regions to provide information on basic hygiene practices and social distancing messages, and to distribute soap bars to every household in polio high-risk areas. So polio eradication structures, including the emergency operations centres, continue to support the COVID-19 response. Key areas of support include coordination through the EOC platforms, surveillance for suspected cases at the health facility and community levels, and capacity building of healthcare workers, risk communication, and distribution of printed and personal hygiene material. The programme is also supporting the country to procure much needed supplies. Next slide, please. So our work is really more important than ever. While the GPEI faces significant challenges to sustaining and expanding progress, we can and we must continue our efforts. As we have seen with other diseases, including measles, yellow fever, and Ebola, polio eradication infrastructure continues to contribute to broader global health efforts. A win for polio is a win for global health, and that's the theme for this year's World Polio Day. The Global Polio Eradication Initiative has repeatedly adapted and innovated to address and overcome obstacles. We are resilient, and with continued resolve, we can achieve our goal of a polio-free world. Every dollar we raise, every letter we write to a member of Congress, every time we share information with our friends and family about our efforts, we get closer to eradication. Thank you for all you continue to do to ensure we end polio now and forever. Thank you very much.
Judith, thank you so much for your presentation, for your very impactful graphics as well that you showed us. So I think I would like to thank the four speakers, Judith and Lee, Aziz and Tunji, for the different experiences and insights you have brought and the different perspectives of the areas where you're most involved. Friends, this is a reminder of how crucial it is that we continue working on polio eradication. And you know, we are a big force. You may need to know that since the beginning of this campaign, Rotarians have almost contributed almost $2 billion. This is not money that comes from governments, it comes from all of us. So I invite you to continue making of this an important part of you being a Rotarian. Now I will move on to the Q&A portion of the program. Again, I would like to remind you, if you have a question, please submit it to the Q&A box, not to the chat box. Jeffrey, this is your time now to moderate the questions and answers section, and the floor is yours.
Thank you very much. I have a few questions for one or two questions for all of our participants, but I'd be even more interested in hearing the questions from the floor, from the Rotarian members. So let me start with one question for each of the participants. The first one I would like to direct to Dr. Funsho. Can you tell us something about what work is going on in Nigeria now to ensure that the virus won't resurface there? It took such a heroic effort to eradicate polio in Nigeria, and we would hate, obviously, to see any resurgence. So what steps are being taken to prevent that?
As you're aware, the COVID-19 pandemic, led us to pause our efforts in polio eradication, particularly in outbreak response that we needed to have done because of circulating vaccine derived in January in Sokoto State. we have now restarted. As a matter of fact, 3 days ago, we started our first mass campaigns in Sokoto State, immunizing children with the monovalent vaccine to ensure that we put a lead on the circulating vaccine derived there. Next week, we're going to move to other states. So we have literally recommenced our most important duty, which is to ensure that we get to the field and make sure that children are covered. Now, of course, as soon as the traveling restrictions continue to reduce, our advocacy efforts, in fact, are much more important now because we had started paying advocacy efforts to our governors of the states before the pandemic came. We're going to resume that to ensure that the governments at every level continue to show political will and also provide the human and material resources to ensure that polio eradication continues. We're also making a lot of advocacy to help to ensure that the government strengthens our primary healthcare facilities, because eventually polio eradication efforts is going to rest on routine immunization. So we are looking at a time when campaigns will be much less. And before we get there, we want to make sure that routine immunization levels are high enough to ensure that children are protected even if the virus finds its way back into the country.
Thank you, Tunji. And I have every faith that you will be able to do that. A question for Aziz Memon, and this is actually one that both one of our Rotarians posed and one that I had written out earlier. Do we have a timeline and a strategy in place for the ultimate eradication of polio in Pakistan? We've been at this for a long time. It is even more so than Afghanistan, a stubborn outpost in polio. So how do we see finally pushing this over the cliff to full eradication?
Jeffrey, if you look at the map showing the red dots on Afghanistan and Pakistan side, you will see that both are very close to each other.
Right.
Both countries have the same epidemiological block. Now and then there is a constant movement of population because historically it used to be one country and the people keep on moving for no reason or rhyme. So we have, just not to look after the outbreak of Pakistan, but we need to keep an eye on Afghanistan also, where the cases have shot up to 52 white polio cases, plus the derived cases. In Pakistan, we have the commitment of Chief of Army Staff, which to us makes a lot of difference, and we need that commitment because the northern tribal areas, there is no law, no rule there. So we need to fight with them while we are able to save the children from this crippling disease. So, and then if you look, one more thing, Jeffrey, if you look at the cases, 80% plus cases are just from Pashtun community. Now the Pashtun community is right from the north, but then they move and they come and migrate till Karachi, where they settle down for getting jobs. So if you look at any of these super high risk areas, those are the areas where this community is staying. Now we are the advocacy program being chalked out by UNICEF is just focusing on a revised strategy to look after and take care of the Pashtun population. We have also made several drills to see as to how we can reach them, whether inaccessibility or anything, we have to get there. we have to give the drops. Now, answering your last point, we have a time frame. Well, as in little while back, talking to the trustees, IPPC chair Mike said and repeated the word of General Bajwa, Chief of Army Staff, that we want to stop transmission in 2021 in Pakistan. Well, Mike said he cannot believe the words. I also say I do not believe those words. But if they are, saying it again and again, we hope that we will do it soon. And as in my remarks also, I mentioned that one general is just given the polio task. He is totally committed and he reports to the Chief of Army Staff. And we cannot do the immunization without their help in Bannu, in Lucky Marwat, in South Waziristan. So this is our story. I know a sad story, but there is a silver lining and we will do it. And we'll do it soon.
I have full confidence in that. Just like in Tunji, I have a feeling that the two of you, when you put your minds to this, will get these jobs done. I have a question for Anne. You have participated in, I'm reading here, 30 volunteer national immunization days. I had the opportunity to participate in just one and found it both thrilling and, quite frankly, exhausting. It was the kind of exhaustion that lifts you up and makes you feel very gratified. But still, I was pretty wrung out at the end. Can you tell me some of the highlights of those expeditions into the field and how you've been able to keep your energy level up during that work?
There's a secret there. It's called passion.
That's very nice.
It's called passion. It is exhausting because I do go for 2 weeks periods, and there's been highs and lows on every trip, but primarily I have to tell you that it's the people. It is the people within these countries that motivate you to do more. And of course, it's those children. I've looked into the eyes of thousands and thousands of children, and that's what keeps me going. And then you look up into the eyes of their parents who are so appreciative, and that again keeps me going. And along with the dedication that Rotarians in these countries display, that also keeps me going. And so that is why, yes, I come home after 2 weeks and collapse, but I just rest up and get ready to go and do it again. And I'm really grateful. There are some bad things no, I shouldn't say bad. There are some challenging things. I mean, I got malaria in Nigeria, as Tunji will attest to, and I thought I was going to be gone, but I managed to survive. And but there are also some really good, and if I could just take 2 seconds to share a little story, and I will tell you what keeps me going. I went this was in Nigeria, into a little one-room school, nursery school. And there was just a basic seat on all the walls. And so the teacher said to the students to go in and sit down. And then I entered this little room and I started to put the drops in the mouth of each child. And they turn up, they're just so precious. And all of a sudden I felt a tug on my pant leg. And I looked down, there's this little boy. And the teacher comes over and says, no, it's not your turn. And she puts him back on the other side of the room. So I continue my work and my friend behind me is marking the fingers. And again, I feel this little tug on my pants. And the teacher again said, no, it's not your turn. And I finally got to this little boy, and he looked up at me with those big brown eyes, the most handsome guy. And he looked at me and he said, I love you, Auntie.
Oh, no.
And so, to me, that was the best thank you I have received ever. And I like to tell that story because, at that one moment, that little boy thought I'd traveled halfway around the world just for him. And I don't think it was just a thank you for me. I think it was a thank you for all of Rotary. Sure. Because, these children are never going to meet the people who fund this. But let me just tell you how much they really appreciate it. And that's my motivation right there.
That seems to be more motivation than anyone would need to get out there and continue doing that work. That's very heartwarming. One question for Judith. Your work involves carrying forth the complex mission of getting the message out there, of explaining the urgency of eradicating polio. In a world in which there is so much disease in so many lands, which admittedly claim more lives and more victims a year than polio does, what do you think needs to be done to explain to people about the urgency of eradicating polio, even though compared to, say, malaria and HIV, it has a much smaller victim count? And yet we continue to push so hard to eradicate it. How do you explain that to people?
Thank you, Jeffrey, for that interesting question. I think there are several things. Obviously, when you're advocating to governments trying to get money out of them, you are competing with a myriad of other causes. And it's not easy to keep polio at the forefront, no question about that. And these days as well, the way of global health, it's all integration. And of course, polio is a very separate program, although it is being integrated more and more with other health interventions. But the way to do it, and the facts are, A, there is a vaccine, it can be cured. It's a disease that can be cured. And we have proven that we can do it. And I think for me, the evidence of that, which I do relate, was going to Delhi. And we just heard Anne Lee talking about her amazing experiences of 30 NIDs. I had the privilege of going to one in Delhi in 2016. And the thing that struck me there, by that time India had been polio-free for 5 years. There were no children there, of course, with polio under the age of 5. Lots of older children, none under the age of 5. And that's when it really hit me on the importance of this program. You know, we're stopping people being disabled, we're stopping people dying. It's really making a huge difference, and it's doable. And I think with India is celebrating 10 years of being polio-free next year. And when I was in Delhi, I had a lot of discussions with the National Polio Chair there, Diment. And like Tunji and Aziz, I mean, these people are just saints. They've been working for many, many years, day in, day out, on these really challenging work. And for me, it's India being polio-free to me, is like a miracle. You know, and I believe, and I think at the time when they were declared polio-free, if India can do it, anyone can do it because of their burgeoning birth rates. Sure. And of course, we've just seen the wonderful news now of Africa being certified polio-free. And so it really does add some momentum to the argument to keep giving the funding. And certainly with the UK government, which is the government I've had the most experience with, they are very much on board. They've been with us from the beginning, and they are still a major donor. They're the second major donor after the US government. And even possibly even more important than that, they are also a very important advocate for the polio program in global circles. So at the G7, most recently at the UNGA, at the G20, at the Commonwealth Heads of Government meeting, the UK Prime Minister is there fighting our corner. And because again, they realise it can be done and should be done. And the other really strong argument, which resonates with finance ministers, is that what if we don't carry on funding it and we just stop now? Well, WHO say there'll be 200,000 cases within 10 years. We'll have an epidemic and everybody will, and there's a lot of fear around now with COVID, which Anne Lee very eloquently described. We could be in exactly the same position with polio if we don't keep up this fight to end it. We are so close now, and we have to finish it. Thank you.
Thank you. That's a good and clear answer. I'm going to frame one question to anyone who would like to answer. A Rich Tatara from Naperville, I believe I'm pronouncing that correctly, asks, now that we have got wild polio on the run, what can we do best to curb or eliminate vaccine-derived polio, which of course appears to be running a rearguard action against the efforts to eradicate the disease? And I throw that open to anyone in the group.
Should I take it?
Sure.
As I mentioned in my remarks, Jeffrey, that the new vaccine for which a lot of research and money has been put in, the Nova vaccine, is about to be rolled out. As a matter of fact, it was supposed to be available in September, but it has been delayed. But enough doses would roll out before this year comes to an end. And there are big hopes attached to this vaccine, that this vaccine will be able to take care of the derived cases. Plus, in those parts in Africa and the subcontinent, wherever derived cases are taking place, we need to improve our routine immunization to curb down the derived cases. These are the 2 points. Thank you.
Okay, thank you very much. A question somebody asked for Tunji in particular. Is it compulsory to vaccinate children in Nigeria in order for them to be admitted to school? This is a big issue that comes up in the US all the time. It's being hotly debated. And how is Nigeria dealing with that issue?
It is not compulsory nationally. A few states have enacted laws that makes it compulsory for children to be immunized, but they are very much in the minority. The federal government has not enacted any law to that effect because most of the states are not enamored to that kind of law.
So there would be resistance then in the various states. There are, what, 36 states in?
Yes, for the Federal Capital Territory, yes. There will be not resistance to the vaccination, but resistance to, because for instance, there are certain states where, because children do not have easy access to immunization.
Right.
It will be an additional barrier to their progress in life if you deny them entry into schools because they are not vaccinated.
Right.
So states that are well aware of this imbalance in the opportunity for children to be immunized, not only against polio, other vaccine preventable diseases, find it, a double jeopardy thing if a child is prevented from going to school, because they are not vaccinated. But some states have the confidence that they have provided enough access for all families to avail themselves of the vaccines, and they've enacted law at the state level to ensure that there's compliance.
Excellent. Thank you very much for that. I am being told, if you could see my question list here, we have, I would say, 24 questions coming in from audience members who would love to be asking this wonderful panel more, but I am told by our schedulers that we need to wrap up the Q&A period now. I will turn this back over to Eric, I believe. And I want to thank all of these panelists for being part of it. I have said before, I say this with humility, you folks are the ones out in the field. All I get to do is sit at home and tell your story. I like to think that that makes some small, modest contribution, but I'm looking at a panel of heroes here, and I am always mindful of that when I work with the polio groups. So thank you very much for indulging my questions. And now I will toss back to Eric.
Thank you so much, Jeffrey. That was a fantastic conversation, a fantastic discussion. I know I certainly learned a lot. I want to thank you, Jeffrey, and I want to thank our 4 panelists here. I hope everybody in the audience gives a virtual round of applause for our panel today. And I think a fantastic way to thank them is to support them in the work that they do. Again, you should see the link in the chat box to donate to the polio campaign, Pioneers for Polio, for our District 6450 fundraiser. Let's make it a historic amount that we're going to raise here as a district. And just a reminder that your money will be matched, at least for now, on a 6-to-1 basis. So again, thank you very much. So I want to move on and move to the announcements, the regular announcements for our club, and try to get us out of Zoom here as close to on schedule as possible. Our meeting today is supposed to conclude about 1:30. So I want to start by talking a little bit about the District 6450 iPad donation. You may notice it floating around the news here in the Chicago area. It's been in the Aurora Beacon News, Naperville Sun, and even in the Chicago Tribune. Rotary One helped fund this project, and many thanks to our own Sarah Buck, Bernard Groth, and past District Governor Pedro for distributing iPads at Roseland Hospital and Advocate Trinity Hospital as part of this effort. I'm also asking and looking for our Rotarians to submit stories about their Rotary experiences or work they're doing with other organizations that may be of interest to Rotarians. I do want to feature you. You're our members. I want to make sure that you're out there on our social media feeds and the Gyrator. So send an email to the club, to the office, if you have an idea for a submission. It's also in the Gyrator newsletter. There's some volunteer opportunities coming up as well. Every Friday at 5:30 p.m., we're delivering meals for seniors, who are low-income seniors who are adversely affected by COVID-19. That's at 150 West Maple Street. Visit our website and calendar to sign up for that. Also, in November, as part of National Homelessness Week, on November 14th, I'm looking for all hands. Anybody who is willing to come out and help on that day. We're working with the Safe Haven Night Ministry and Salvation Army, as well as several other organizations, to distribute 2,000, that's 2,000 hygiene kits to the homeless in Chicago, along with hundreds of meals. The week before that, on November 7th, we'll be at the Salvation Army facilities in Uptown doing a hygiene kit packing day. Again, the information is in the newsletter. It's on the calendar. As always, we have a lot of committee meetings coming up and board meetings. All are welcome to attend. All are on the calendar. I want to point your attention specifically to the nominating committee. That committee is meeting now, and they're looking for everybody's input. If you're interested in serving as an officer, a director, or you think you know somebody who might serve well in that position, do reach out either to the office or reach out to past President Marshall Schmidt to make those recommendations. In terms of other meetings coming up, we do have our in-person Friday roundtables at the Union League Club of Chicago. That's every Friday at noon. Also next week, our very own District Governor, Chuck Corrigan, who's here with us today, will also be back visiting with us on the 27th to tell us a little bit about what's going on at the district level. And that meeting is going to be in person. So if you've been missing our in-person fellowship at the Union League Club, please do come out for that. We will use it as a little bit of a gauge to see how comfortable people are meeting in person these days. But if you're not, that's also okay. We will have a Zoom feed set up for that meeting as well. And then November 3rd will be a Rotary After Work to be determined a meeting. So that is going to move us here to the four-way test of everything that we think, say, or do. And I'm going to ask our four panelists to help us out here today. And I'm going to go through one by one and ask each of them to read one item from the four-way test. So Tunji, I'm going to start with you and ask you to read the first item of the four-way test. And it should be on your screen.
Yes, you want. Okay. The four-way test of the things we think, say, or do. First, is it the truth?
Perfect. Thank you, Tunji. And Lee, I'm going to ask you to read the second item of the four-way test.
Is it fair to all concerned?
Thank you. And then Judith, could you read the third item of the four-way test?
Will it build goodwill and better friendships?
Fantastic. And Jeffrey, you know you're going to be my number 4.
Okay, happy to do it. Will it be beneficial to all concerned?
Thank you so much, everybody, for coming. Meeting adjourned.